Okay, so that's just a sampling of the stories that we have to tell in this room and in this city right now around tongue and lip ties. And even more mothers and their babies have gone to New York to have their ties revised in the last few months. I'd like now to ask Dr. Kotlow to come and give us a few words. We are so very grateful.
Well, you know, I get to see the revisions and do them, but I don't get to hear the whole story before and afterwards. I can appreciate the emotional roller coaster everybody goes through, and as you can tell, my generation are all screwed up because none of us breastfed. You know, back in the 40s, 50s, that wasn't in vogue, if you remember. Well, you won't remember, but when you had a baby, the baby was in isolation for 2 weeks, and no one was allowed to even get near the baby because we were going to get the baby infected. So breastfeeding wasn't even an option. I listen to your stories, and I hear it day in and day out, because right now I'm doing 5 or 6 babies a day, and it can be all-consuming within my practice. But what bothers me is it's a procedure that takes about 90 seconds. And the only way to really be successful with all of this is to get the medical schools and the dental schools to teach a little bit about breastfeeding, because I don't think they realize that's part of dentistry, part of oral care. And I hate to use the word ignorance, lack of education, but our healthcare professionals ignore what's going on in the mouth until the baby is 3 years old many times. And by then, it's not just breastfeeding, it's tooth decay, it's malocclusion, it's diet, it's nutrition. And every one of you mothers who come in with tears and leave with smiles most of the time. And for me, the most gratifying thing I do in dentistry is working on the babies. I'm not going to retire pretty much as long as I can see what I'm doing and my hands work. I may cut out doing fillings and drilling, but I'll always work on the babies as long as I'm able to, because it's the most satisfying part of doing dentistry. I'm not going to give you a lecture tonight on what I do, because that's what tomorrow is all about. If I give you this tonight, you won't have to come tomorrow. I've been asked if it's advantageous to have one of your dentists come and visit me for training. But you know what? There's not a whole lot of training. It's being able to diagnose and not being afraid to treat. I think that whether it's a man or a woman dentist, you don't get anything in dental school without it. And as I alluded to in speaking to some people here, I've been in practice now 40 years, and when I first started my practice, the first time I actually had a breast pop up in my face, I didn't know where to look. You know, there's nothing, zero, absolutely nothing, okay, about breastfeeding in dental school. I've created this expert in my name because I've taken it upon myself to do the procedures because I didn't want these kids, no matter what age, to undergo general anesthesia. It's an elective procedure that has risks. There is absolutely zero reason for any infant to be put to sleep. The procedure is 90 seconds, and I want the baby to cry. I want to hear that baby cry, because in infants, the last thing you want to do is have a baby hold their breath and go into respiratory arrest, because they're going to die. Okay? So crying is a good sign. The baby's healthy and crying. Because as soon as that baby stops crying, I stop cutting. Until it gets a few more breaths, and then we go back in and do it. So if you know anything about CPR, basic life support, in children, before you get cardiac arrest, you get respiratory arrest. So again, I'm not trying to scare anybody because it's a very safe procedure, but when someone says, are you going to numb him? Are you going to do this? No. For a 30-second procedure, a 90-second procedure, I want that baby to go right back on the breast as soon as I'm done. And probably half my patients travel anywhere. The farthest has been Beijing, England. We have 2 maps in the office, one of the United States and one of the rest of the world. And for my Christmas present this year. The girls put the maps up and put pins in with the labels of every country and state in the world that we've seen. I've had people fly in from the Middle East, Bahrain, Israel. I've got one coming from the UAR, United Arab Republic. They're waiting for the baby to get bigger. Canada is up there with the United States. There's a number of places. Everybody east of the Mississippi comes. But training in my office is watching me do the procedure. I think anyone who comes tomorrow, if they're not afraid to handle a baby, if they understand what they're doing, should be able to pick up a laser and do it. That being said, tomorrow, the first 2 hours is going to be on lasers. It's going to be on laser safety, explaining how lasers work, why they're better, why they're different. And it will satisfy a requirement from the Academy of Laser Dentistry for anyone who wants to use lasers for an introductory course. It will also give you, who are not dentists, physicians who can't cut with a laser, an understanding of what we do. I gave this course in my office. I had about 20 people, half were lactation consultants, and not one of them shut their eyes and went to sleep or decided that it was a waste of time. So it's interesting. I tried to eliminate the boredom because it's physics. As I went through high school, I failed one course twice, and that was physics. When I went into pharmacy school, I got a C in physics. Now I teach physics. So you never know what you're going to do in life. And if I had the opportunity now, physics is fascinating. And when you understand that everything you learn in physics, from mathematics to light energy to electric, you use every day in your home and your life, and you really need to understand it, even though it's boring. But I think that's the teaching. So the next part, at least 3 hours in the afternoon, will be on a little bit of the history of breastfeeding, as well as a little bit on prenatal care, because we're dealing with a patient, a human being. We're not dealing with a tongue tie. We're looking at the overall effects of the lip and the tongue. And I kind of get a kick at everybody tossing me around the word lip tie, because I'm the one who coined it. Because I felt it's not really a frenum. It's a piece of the inner lip attached to the maxillary arch. I have an article right now in review, which I'm trying to get published. It's been turned down twice because there's no references. Because there can't be no references. And I've been told that I cannot change the name of an anatomic structure. It is a maxillary frenum. It is not a lip tie. Unfortunately, to that person, I said, go to the internet and type in lip tie. Because it is one expression that is effectively used by all lactation people today. And I think it is adequately describing what we've got. For those who don't think it's a factor, come tomorrow. I'll explain it again. I'm kind of looking forward to tomorrow. I get teased because dentistry is not only my vocation, but it's my avocation, it's my hobby. As my wife will tell you, I'll sit in front of the computer at night and create a slide, which could take me 3 hours. My slides are busy, they're active, there's a lot of information in them. And my lecture changes, even though you may hear it once, I add to it. And I listen to the mothers who come in, and I listen to what you say, and I add to my lecture to try to counter what you're being told. So when I speak to groups of people, I try to hit everything that you're told that has no scientific validity. And what I do tell you, that is, when a doctor says to you, there's no random control studies to prove it, your answer is, will you show me a random control study that disproves it? Okay? I have patient after patient we do this on, and it's repeatable. And you can repeat it. Your job is to tell me I'm wrong, not for me to tell you what to do. So, you prove me I'm wrong. As I tell my wife, there's a 50% of the time that I'm right, and there's a 50% of the time you're wrong. So, you know, I stick to my guns. If you can prove anything I say is wrong, I'll think about accepting it. But for the most part, whatever I have to say, I'm supremely confident in my diagnostic skills. what I do, and no one's going to change that. My good job is to change them, not me. So, again, I don't want to get into too much of what I'm going to talk about tomorrow. I wouldn't do any of the surgery, but I do all surgeries. I don't even have scalpels in my office. I don't have surgical scissors except to cut sutures if I have to suture something. But it's not just tongue ties and lip ties. I biopsy babies. I do mucoseals. I do all sorts of soft tissue surgery on infants using laser, as well as older kids. I mean, I did a 16-year-old girl yesterday who had speech problems, which was referred to me from my craniosacral therapist. I work with my functional therapist. What bothers me is when people go for tongue ties, when they go for speech therapy for 5 years, and I can fix the speech in 5 minutes by a tongue tie release, by having them go from thunder to thunder, because you can't get the tongue out. Again, we'll talk a little bit about that tomorrow. So, we're going to be talking about babies and tongue ties and lip ties, but we're going to go down the whole realm of what happens before the baby's born, so that you can think about that. We're going to talk about a little bit about infant tooth decay, what you know about that, why it occurs. We're going to talk about some of the older kids, 3, 4, 5, and 6-year-old who haven't had the procedures done. And since I'm not on the lecture circuit with anybody else, I can talk about whatever I want. I don't have to get off. And I've never been accused of not having enough information. So when everybody gets tired and bored, we can stop. Otherwise, I don't think we're going to have too much downtime tomorrow. I have been talking through lunch, I'll pass out, I'll get to that too. But lecturing is fun. I haven't been home a weekend in the last month because my wife and I took our first vacation for a long time, went to France and took a cruise, and last week I was in Chicago lecturing on this. I'm here, and then in November I'm going to Italy to speak on this. So I enjoy this. We'll have a good time tomorrow. If anybody has any questions they want to talk about tonight, I'm going to tell you I'll discuss it tomorrow. I'll answer it now.